Assalamu alaikum wa rahmatullah wa barakatuh. Good morning or good evening, whatever the time with you is. First of all, I hope you did very good in your exam. So, today we are going to continue our lectures regarding pneumoconiosis. Already we mentioned the silicosis and asbestosis, and you remember we said if there is a time we are going to discuss the third kind, although there is more and more, but the other kind is anthracosis. This is anthracosis. What's anthracosis? Or the other name of anthracosis is the coal worker pneumoconiosis, or they call it black lung disease. From its name, you can see the lung will be black in color, or it is related to the coal worker pneumoconiosis. So it is an accumulation of coal from its name, dust, and then the reaction of the lung toward this dust, as any other of pneumoconiosis. It's really associated with the mining industry. It's one, it occurs during, for the exposure of 1 to 2 decades to cause symptoms. As any other pneumoconiosis, it takes long time. The disease usually divided into two types. We have simple coal worker pneumoconiosis and or black pneumoconiosis, whatever, and the complicated coal worker pneumoconiosis, or it is a progressive massive fibrosis as that of the silicosis and asbestosis also we have to do. Regarding the simple coal worker pneumoconiosis present on the radiologically, there is a patches opacity, radiological opacity, which the size of this opacity is less than 1 centimeter in diameter. So it's small one. It's a benign disease if no complication occur. This is regarding the simple, definitely. It's associated with the little respiratory impairment, and this phase may be required about 12 years to be from the exposure of the coal dust. It means after 12 years of exposure, the worker or the person will have these symptoms. Still, it is a simple. The common symptom, what are the common symptom? Of course, cough and expectoration. But the diagnostic point for this expectoration is a black color of expectoration as a result of a cool black. And there is dyspnea. There is a slight decrease in FVC and also FEV1 in relation to the FVC. Once a black ground of a simple pneumoconiosis had occurred, had a dent in the coal worker, then the progressive phase of the anthracosis or a coal worker pneumoconiosis will appear. In another word, the progressive massive fibrosis will be developed even if there is no further exposure, even if there is no exposure of the person. From the point of view of epidemiological point of view, the risk of death among coal miners had been nearly twice that of a general population as a result of the black pneumoconiosis among the miners. Now we said after 12 hours, and then the progressive massive fibrosis will occur even if there is no more exposure. So we will come to complicated coal worker pneumoconiosis or progressive massive fibrosis. It is diagnosed when a large opacity, more than 1 centimeter, occur in the chest. So 1 centimeter and more, presence of 1 centimeter or more patches in that by chest tracing, it means this is a massive, progressive massive fibrosis of coal worker. Pathologically, it's characterized by large masses of black color fibrous. So not only the sputum is black, well, expectoration is black, but also the fibrosis, the color of this fibrosis is black. So diagnostic characteristic is a black color fibrous tissue. Symptoms are similar to the simple one, but of course it will be more and more severe. The large lesion might be cavitated, and this cavitation, as you remember also, we said it either due to the necrosis or due to the infection of TB. So recurrent pulmonary infection were liable for these cases. Pulmonary function test, of course, it will be decrease more and more. In the second phase, progressive fibrosis, characterized by severe respiratory disability and frequently result in the premature death. Once severe respiratory disability, then premature death will occur to this patient. Special type of progressive massive fibrosis is associated with the rheumatoid disease. Also, you remember we said it in silicosis and asbestosis. With the rheumatoid disease, or we call it rheumatoid pneumoconiosis, or the name of this disease is, we call it Kaplan syndrome. Okay, Kaplan syndrome. It occurs when a smooth rounded nodule 1 to 5 centimeter in diameter will be seen by X-ray. Pulmonary function test is obstructive, or it may be mixed in the chest X-ray. In the simple, as we mentioned, there is a nodule which is less than 1 centimeter, frequently mixed nodule and irregular, and occasionally exclusively irregular opacity. Its irregular opacity was noted in the upper and middle. So in this case, you can differentiate it from between the 3 types of the pneumoconiosis. One of them in the upper, the other in the lower, while here it is in the upper and the middle zone of the lung. Irregular opacity, this is irregular opacity, also the size of the opacity, you remember we can differentiate it. Okay, it occur maybe as a result of previous exposure to the asbestosis. Progressive massive fibrosis appear radiologically as a nodule opacity. We said 1 centimeter or large already. We mentioned it here. We finished. Usually found posteriorly in the upper zone. There is so many differential diagnoses for small opacity, miliary TB, definitely, and other pneumoconiosis will be differentiated, but again and again we will say the characteristic feature is that there is a black color of this nodule. In addition, the sputum is black, or expectoration will be black in color. So here you can see the difference, the X-ray difference between the 3 types of the pneumoconiosis, and you can differentiate it between them. Diagnosis and the clinical assessment, of course, as any other pneumoconiosis, history of exposure, or even the past history of exposure. Looking to the X-ray, definitely, from the size, from the color, and from the location of the opacity, you will diagnose the type of the pneumoconiosis. Sign and symptom, cough, sputum, and again and again we say it, there is plaque expectoration. A treatment, as long as there is no specific treatment, as we already said, that even if there is no exposure, the simple will change into a complicated one. So the treatment will be symptomatic treatment for dyspnea and chronic bronchitis and many other diseases. Okay. Now, just now we said coupling syndrome. What's coupling syndrome disease or coupling syndrome? Or they call it coupling disease or rheumatoid arthritis. We already mentioned that it occurs in the asbestosis, silicosis, as well as anthracosis. So it is a combination of rheumatoid arthritis, all right, and pneumoconiosis. Manifested in the intrapulmonary nodule. There is intrapulmonary nodule, which appear homogeneous and well defined on the X-ray. The nodule in the lung typically occur bilaterally on the both sides and peripherally on the background or a simple cool worker pneumoconiosis. There are usually multiple nodules varying in size from 0 to 5 centimeter. From half centimeter to 5 centimeter, and it's big. It's very big. Multiple nodules. The size is 0.5 to 5 centimeter. The nodule typically appear rapidly because become complicated. Only within a few weeks, nodule may grow and remain undiagnosed in size, and it may resolve by itself, it may disappear, and it may reappear. So they can have this nodule may be cavitated, and there may be development of air fluid level inside this cavity. Coupling syndrome, so of course there is missing of S. Coupling syndrome occur only in patients with both rheumatoid arthritis and pneumoconiosis. So we call it coupling syndrome when there is rheumatoid arthritis as well as pneumoconiosis. This pneumoconiosis, of course, related, as we just mentioned, is related to the coal worker and asbestos and silica. Exposure to coal, asbestos, and to the silica. Not every person will develop coupling syndrome, so there is a genetic predisposing factor for the occurrence of the coupling syndrome. Also, smoking is an aggravated factor for occurrence of the coupling syndrome. And you remember we said most of the pneumoconiosis affected by two factors, by the person and also by the environment of that work. So the person is genetic and smoking. Kindly, my student, you can see here, I give you some abbreviation among the difference between the three type of pneumoconiosis, silicosis, asbestosis, and anthracosis, depending on so many things, depending on the agent, depending on the exposure in which the workplace, and depending on the incubation period, or we call it latent period. Okay, and pathogenesis, there is a differentiate, you can read it, and in addition, clinical feature of these diseases. So it is abbreviation of the all the lecture that had been given to you, but it assisting you to remember all the comment. We said at the end we have to find something prevention and control of pneumoconiosis. So rigorous, definitely. First of all, rigorous dust control measure. This could be either mostly engineering, substitution, enclosure, isolation, hydroplasting, good housing keeping, and also periodic examination. We should never forget periodic examination. included all the examination of the clinical history, chest X-ray, other laboratory tests. Then we have protection, personal protection, and regulated exposure, and health education. So this is the prevention in general of pneumoconiosis is similar to the other prevention of occupational disease. Of course, definitely medical measurement, engineering measurement, and other measurement. And always we say the engineering measurement is the first line of measurement, preventive measurement, I mean, in the occupational disease. What are these medical measurements? Of course, pre-placement, periodic examination, which is screening in type, medical and healthcare services, notification. You remember we said occupational disease are notifiable disease. Okay. Maintenance and analysis record, it should be available all the time. Okay, records. Health education for the and counseling, always we will educate the worker. Practicing good personal hygiene, you should never. Good, what's this personal hygiene? Washing hand and face before eating, drinking, and smoking, you remember? And also before and after using toilet. Prevent eating or drinking in the area when there is a exposure to silica or any other dust. Wear protective clothes, PPT, okay? Before leaving the work, shower should be taken. You remember we said because of the family member. Leave the dust, we have, or they have to leave their dusty clothes at work. So they change their clothes and leave it at work, and then after taking a shower. Engineering measurement, design of building, which is the most important, or the first line in the prevention of occupational disease, is engineering measurement. Conduct air monitoring to measure the work exposure. Minimizing exposure by controlling certain airborne, for example, using wet drilling, okay, wet drilling, local exhaust ventilation separated to certain area, enclosure, isolation, or put it in enclosure or isolated the area of high exposure, environmental monitoring and prohibiting dry cutting, please take care, prohibiting dry cutting, but promote weight cutting. Prevent. Let me show you this picture, then we will come. So, look, prohibit dry cutting and promote weight cutting. So this is very, very important. Other measurement, legal measure, of course, a law and so on, others measure to minimize dust emission and exposure to the dust, try to minimize it. Law compliance mechanism included effective workplace. A mechanism for collection and analysis of data should be available. Okay, and occupational disease in order to have, you remember from the beginning, we said that we have to have a baseline and then to know the morbidity and mortality. So we have to analyze all the time. We have to do some research and analyze. Collaborated with the social society scheme for covering occupational injury, a training of a health professional. Okay, this is very important because you remember we said most of the occupational disease are underestimated because most of the provisional, they are not analyzed, or they are not taken care, or they are not diagnosed. the occupational disease in a proper way. Training of a health professional in occupational disease as a majority of medical practitioners lack training in the as they are lacking in training of occupational health, as the other we mentioned. So already we finished with the pneumoconiosis. This is the, as I mentioned, prohibit dry cutting and promote wet cutting. You can see here. Now coming, you remember this is a chemical hazard, exposure to chemical hazard. So other chemical hazard, we have, what do we call it? Heavy metal hazard. Okay, regarding the heavy metal hazard, we are going to discuss exposure to the lead and mercury. Toxic metal included heavy metal, include, of course, the that the individual metal and metal combined, either as it or as a combined, that negatively affect on the people health on the worker. It affect, actually, all of us, we need this metal, but in very, very, very small amount, very minor effect. So very small amount, many of these metals are necessary to support our health, our life. But when it increases, of course, it will make a negative effect on our health. However, in a large amount, it will become toxic or it will cause a negative effect on our health. They may build up in the biological system and become a significant health hazard when we ingest it. So many heavy metal we have lead, we have mercury, arsenic, cadmium, beryllium, and so many other. But because of shortage of time, mostly we are going to discuss the lead and mercury. Okay, today I'm going to I am going to discuss some, not all the lead, because I don't think the time is enough, and we will continue. Yeah. Coming to the lead poisoning. So what we are going to discuss in this lecture, or even in coming lecture, inshallah, we will continue. Source, the source of lead uses, body store, where it's stored, and distribution. Lead poisoning, clinical feature, diagnosis, management. Lead exposure, lead overexposure is one of most common overexposure found in the industry. It's one of the most common. It's a leading cause of workplace illness. Therefore, the Occupational Safety and Health Administration, OSHA, Occupational Safety and Health Administration, has established the reduction of the lead exposure to be a high strategy priorities. They put their priority in their task or in their aim to make a reduction of the lead exposure in many factories. Okay, because it is highly prevalent in some factory. What was this strategy? They said 5-year strategy. Their goal is to minimize up to 15% reduction in the average severity of the lead poisoning, either 15% in the severity of the lead poisoning or 15% of the employed blood lead level in certain selected industry, at least. In certain factory, the blood lead level is high, so they would, the prevalence, so they would like to decrease it at least 15%. Lead poisoning in general, not only in a worker, it is also a major potential public health risk in general population. It occurs also in many other populations. Lead poisoning is a leading environmentally induced illness in children. So it is in general population, in children also it's a leading illnesses among children. Children under age of 6 years are at a great risk of becoming or to have a lead poisoning. Particularly, they are undergoing a rapid neurological and physical development, so they are under a very serious condition of a lead poisoning. So, lead may be present in a hazardous concentration in the food, in the water, and also in the air. That's why it is affect the children, particularly children under age of 5, because of they are under development, neurologically and physically development. We said for the population where the source coming from, including paint, whatever the paint, okay, urban dust and folk remedies. So all these are a source of lead poisoning. Lead dust or foam are inhaled or ingest. So the mode of transmission or entrance to our body is either through inhalation or ingestion. So ingestion occurs as a result of contaminated hand, contaminated food, just now we said, contaminated water, contaminated cigarette, or even contaminated clothes, then my hand will be contaminated and it comes through through the ingestion. Lead entering the respiratory and the digestive system is released to the blood, and then it goes to the blood and then distributed through the body. More than 90% of the total body burden of the lead, it will be accumulated in the bone and it will be stored in the bone. More than 90%. Lead in the bone may be released again and go to the blood. So when it may release, go to the blood, so re-exposure to the organ will be occurred after a long period of time. Body stores the lead in an average lead in the average adult population. The body stores 150 to 400 milligram. For 150 to 400 milligram. When the blood level, the average blood level of the lead about 25 micron per 100 mils, this is almost normal. But when the blood level 70 micron per milliliter per 100 mils, then this will associate it with the sign and symptom of lead poisoning will be appeared. But normally, normal adult and just about 0.2 to 0.3 milligram of lead per day, largely from food and from the beverage. We said we need it. So we needed a small quantity. We ingest food or any other beverage, 0.2 to 0.3 milligram per day. Okay, we will see the level. Okay, so it is present in 25 micron per 100 mils, almost, we can say it almost normal, but the sign and symptom of the lead poisoning appear when it is 70 microgram per 100 mils. This is the deposition of the lead in the bone. We said it's go and deposit in the bone or stored in the. What are the mode of regarding the mode of absorption of the lead? Lead poisoning, or we call it pumpsism, may occur in three ways. We said either inhalation, ingestion, or skin. Most of the cases, particularly we are dealing with the occupation, most of the cases are of the industry are through the inhalation of a fume and dust that containing lead. Ingestion or poisoning by ingestion is less common regarding the uh, worker, but it's a population. Small quantity of the lead trapped in the upper respiratory tract, okay, and may be ingested again. So we inhale it and then ingest. That's why. Lead may be also ingested by via food and drink, as we mentioned, or via contaminated hand. But the most important is via inhalation. Skin absorption through the skin occur only in a respect of what, how can occur? There is two types. Organic compound of the lead, especially tetrathiol lead. Inorganic compound, it will not absorb through the skin. So only the organic compound. As we mentioned, when we inhale it or ingest it, it goes to the blood. So the distribution in the body, distribution of the lead in the body, we said 90% of the ingested lead is excreted with the stool. So the lead absorbed from the gut enter the circulation. We said 90% it goes out with the stool, but then coming those absorbed from the gut, okay, 95% of them it goes to the erythrocyte. Then from the erythrocytes it transported to the liver and kidney. This is the pathway. Transported to the bone. Then finally it goes to the bone. From the kidney and liver, it goes to the bone where it will be stored in the bone. Just now we mentioned where it lay down and stored. Although in the bone, some of them said it is inactive, but it will react. Although the bone lead is thought to be metabolically inactive, but it will re-release, just now we mentioned. It will re-release to the soft tissue again and under condition of bone resorption. The toxic effect of the lead, how it occurs? Actually, it occurs that the lead probably excreted in a toxic action by combination with the essential SH group of certain enzyme. So SH group of certain enzyme, it will combine with it. And then lead has its effect on the membrane permeability of the erythrocytes. It affects the permeability of the cell membrane, and also the potassium leakage also it will be affected for the erythrocyte. This is the effect of it. They found that the absorption of the lead differ from one person to the other and from one mode of transmission to the other. Orally, if we have lead orally, exposed to the lead orally, in the adult absorbed 10% only. In children, the absorption will be much higher, 40 to 50% of that taken orally, it will be absorbed when among children. That's why we said children are at a serious effect, particularly when this absorption occur when there is a low Fe and low calcium. This is an oral. When the exposure of the lead occurs via inhalation, via respiratory, of course, the size of the particle is less than 1 micrometer, you remember? Okay, so 50 to 70% of the lead will be absorbed. So inhalation is more serious than ingestion. Regarding adult, I mean. Skin, it is little absorption, just now we said, particularly for inorganic never absorb, but the organic. Okay, let us see what are the level. I think I'm going to discuss only this slide, and then we will stop it for the next lecture. What are the lead level are considered elevated, although I put it from up to low. Let's start from down. The typical level for USA adult is less than 10 microgram per deciliter. It means the mean, it is less than 10. So in a mean of 3 microgram per deciliter. This is typical level, normal level. So we said less than 10 microgram. By level of 10, when there is a level of 10 to 25 microgram per deciliter, lead is building up in the body, start to build up in the body. When the level 25 to 40 microgram per deciliter, it means there is a regular exposure is occurring. When I found the patient having concentration of the lead ranging between 25 to 40, maybe 30 microgram per deciliter. So this means that this worker is regularly exposed to the exposure, or there is some evidence of potential physiological problem elevated because it is 25 to 40. Now, if the level, I mean, of course, blood level, okay, 40 to 80 milligram per deciliter, it means there is a serious health damage had been occurred. Although there is no symptoms, but there is serious damage had been occurred in his or in her body. Now coming, if the level above 80, there is a serious permanent damage had been. It means extremely dangerous. Extremely dangerous. So depending on the level of, although I already put it in from high to lower, but I mentioned it from lower to high. So this is according to the level of blood, microgram per deciliter. In 80, above 80, it's extremely dangerous. Okay? Extremely dangerous occurred. 40 to 80, serious elevation. there is a serious elevation, although there is no sign and symptom, but there is a serious elevation, we call it. It means there is a serious damage had been occurred in his or in her body. Okay, between 25 to 40, okay, 25 to 40, there is elevation in the blood level. It means that the person had been exposed or being exposed to the lead poisoning. And then when it is 10 to 25, when I found it is 20, it means he or she is under exposure of lead poisoning. Okay. And this is the diagram for it. Okay. What are the source? The source, lead PB is a heavy metal. Occupational, it occurs just now. We said it's occur in occupational and non-occupational. Just we said that all the population, but the main mode of transmission or mode of occurrence is different. Main source of environmental non-occupational, it means us, is of the lead is by gasoline. This is very important. Also through the drinking water, gasoline, محطات الغاز. Okay, drinking water from lead pipes, particularly if these pipes are very old. Chewing lead paint on toys or شايفين بعض we said it's from paint, so particularly children or baby they chew the paint or من الشبابيك. More industrial workers are exposed to lead through more exposed they are. Sorry. So, more industrial workers are exposed to lead than to any other toxic matter because most of the industry have it. Lead is used widely in a variety because lead is used in variety of industry because of its property. What's its property? Low boiling water mixed with the other metal easily to be mixed, easily oxidized, and anti-corrosive. Lead poisoning, plumbism, all lead compounds are toxic. Most dangerous, we have lead arsenic, lead oxidized, and lead carbonate. Okay. Industrial uses, over 200 industry are counted where the lead is used. These are the industry: shipbuilding, glass manufacturing, printing, just now we said, rubber and industry, and several. Non-occupational source and others. The greater source of environmental, I mean non-occupation, is the gasoline. So all of us were exposed to lead via in the gasoline. It's non-occupational. Thousands of tons of lead every year is exhausted from the automobile, air pollution. Lead exposure may also occur through drinking water, just now we said, from the lead pipes, particularly if these pipes is very old. Okay, chewing lead paint on the window, just now I mentioned, الأطفال ياخذوها من الويندو. Okay, or toys in case of children. Okay. خلينا نوقف لهون. Clinical feature, that's all. We will continue inshallah the clinical feature. Okay. I will make it to you easy today because you are so exhausted from the exam. Okay, and next lecture on Wednesday, we will continue in addition to the Mercury. I hope we will finish these two together during the coming lecture. Okay, thank you very much. Okay, and have a nice, so there's, thank you very much. Okay, any questions, please? I will answer it later on. Thank you very much.